innovation, research, and professionalism.
We are a nursing school that was started way back in 1972, chartered as a midwifery school. The school is run by a highly qualified faculty. All the departments, for example, you look at midwifery, it's headed by someone with a PhD in midwifery. Critical care is headed by a highly specialized person with a master's in critical care. Nephrology, the same. Our clinical instructors for these programs are also specialized in their various fields.
The school is licensed and accredited by the Nursing Council of Kenya to offer holistic training in various nursing programs.
We have general nursing, that is the Kenya registered nurse. We have higher diplomas in Kenya registered midwifery, Kenya registered critical care nurses, Kenya registered nephrology nurse, and also we have theatre nursing, which is called Kenya registered perioperative nursing. We do admit our students from all over the country, especially for the basic diploma, that is the Kenya registered nurse program. And for higher diplomas, we admit, again, we have a Pan-African presence. We have students from Congo, from Rwanda, from Uganda, and from other countries. But basically, most of our students are Kenyan, those ones who have graduated from our Kenyan institutions.
Enjoy your learning in a friendly environment with adequate training facilities, including a fully fledged skills laboratory, library, lecture halls, and accommodation amenities.
We have good facilities for our training. We have a very well equipped skills laboratory. This is for all the programs, both the basic diploma, the Kenya registered nursing, the midwifery, the critical care.
Nursing is a noble profession because we work with our clients at different stages of their lives, right from birth up to end of life. When a baby is born, a nurse is present. When a baby is brought to receive vaccines, a nurse is present. When you fall ill, the nurse is by your side. And even at the end of life, a nurse is present. So we are there to give our services throughout each stages of human life.
For more information, call us on 0732 163 164 or 0719 073 164 or visit our website at www.matakenya.com. A very warm good morning and thank you very much for joining this Friday Health Discourse with me, Sasha Elizabeth. It is a chilly morning, but that notwithstanding, we are ready to discuss a health condition that we are going to know more about in a very short while. But remember, first of all, as it is the tradition, we introduce the medic that is going to walk us through this conversation. And here we go. Good morning.
Morning.
Thank you very much for making time for this talk. You're good?
Yes, I'm okay.
Everything is running well
Everything
back there?
Is fine.
Great. Yes. I can see the smile speaks it all. So as it is, as usual, dear viewer, we value your feedback and we are here for you. So any questions that might pop up in your mind, feel free to weigh in on the conversation through those questions and feedback through our number 0717 424-866. You can as well drop your comments and questions on our social media platforms, because we are live on YouTube and Facebook and on TV concurrently. So remember, this show is brought to you by Capuchin TV in partnership with Misericordiae Hospital, and that's why we have Dr. Okullo representing the team from Mater Hospital. So welcome and let us walk this talk. The hashtag to use, remember, is Friday Health Discourse. Hashtag Sasha Elizabeth. So here we go. Let's start from more often than not, people tend to confuse or use the term seizure interchangeably with the convulsion. So what is a convulsion? How different is it from seizure?
Convulsion and seizures are almost the same thing, but seizures lead to convulsion, but convulsion cannot cause seizures. So when you talk of seizures, that means there is abnormal coordination or abnormal firing of electrical activities within the brain cells. And because of that lack of coordination, it leads to abnormal movement of body muscles. So the body muscles now which are moving without coordination, now that is what we call convulsion. So when someone says he has seen someone having seizures or having convulsions, literally it's almost the same thing, but in more details you realize seizures is explaining exactly the physiological activities happening within the brain and leading to the outcome that you see now physically on the patients. Like now the patient is maybe having abnormal motions of the legs or the hands or the eyes or the mouth. Okay, so this is now the manifestations of the seizure activities within the brain. Now it comes in the form of convulsions. So when someone says there is convulsion or there is seizures, simply means almost the same thing, but more detail now, that's what happens. Yes.
All right, so in simple terms, how can a lay person draw the line between these two terminologies?
It's difficult for the lay person to draw the line. A lay person would easily say whether it's convulsions or seizures, it would be simply for them to understand. Just know seizures and convulsion is very difficult to differentiate. They are almost the same thing. But when you're going to find details of what happens in convulsion and what's happening in a seizure, then you will know into detail that seizures is the activities within the brain causing the physical manifestation in the form of convulsions outside the brain now, in form of the motion of the joint, the motion of the muscles which are uncontrolled. Now when that thing is happening now, we say someone is having a convulsion. But you can have so many seizures happening within the brain and it's not manifesting actively that you can see in form of convulsions.
Thank you very much, Dr. Okullo. These are just medical jargons which, of course, are not inevitable in our discussion on medication. So, convulsion, how long does a convulsion last?
A convulsion is a broad term, as we have said. It's the manifestations of activities probably happening in the brain, and that is not controlling how you should do your activities. For instance, like motions, you could be at rest. You're not supposed to be doing like this. But since you're having a seizure, you present in form of convulsions whereby you have abnormal motions of your muscles and the joint. Okay. Now this can last depending on the types of, for instance, the seizures we are having now. If you have what is called a partial, we can have a partial, we can have a focal, and we can have a generalized, okay? Now, normally, it goes even for, others even can be for a few seconds, like maybe 3-5 seconds and stops. Others can go even for around 5 minutes, but the longer the partial stays in a convulsion state, the more damage and the more side effect it brings to a particular person. So, normally it can go even maximum, even up to, can even go past 1 minute, but the moment a seizure goes more than 1 minute, it's not a good one. Normally it stays for a few seconds, 30 seconds, but again the chances are high that you get repeated seizures. So you can go like for maybe 5 seconds or 10 seconds or 30 seconds, then stops again and then reoccurs again, because these involve a lot of energy and a lot of electrical activities going on. So at the end of the day, it also consumes a lot of energy, And the longer it stays, the more damage and the more side effect it has to the patient.
Speaking of repeated seizures, how often, what is the frequency rate of a patient who has convulsion?
Depending on the type of the convulsion and the cause of the convulsion.
Okay, so
other causes make it has repeatedly, because maybe what is causing the convulsion has not been removed or has not been corrected. Okay, so when that insult is still there, then someone can easily go into convulsion repeatedly. But then if the cause is maybe under control, someone can have it now and then after some time it gets it again. So you can even have repeated seizures within a day, even more than 4 or 5 times, which warrant urgent admission and urgent going to the hospital. But then other people can even stay without even having a seizure or in a day, or having even once in a week. But again, they keep having it maybe every month, or they can even go within a year without having, then they have it again. So it depends on the cause of these convulsions and how has it been managed, and when did it start. So when you have all those, it will tell you how frequent and how repeatedly someone should have the convulsion.
Great.
Yeah.
All right. Now, what types of convulsions are there, and how common are they?
There are quite many, and we may not go into fine details of them, because most of them let me say, can easily be identified by medics at a higher level of training, in that a layman person may not understand what kind of this. The most common for now, that everyone sees from afar, is we can have what is called the partial, okay, and then we can have the generalized, then we can have a focal, okay. When you talk of a focal seizure or convulsion, in a focal point, it's like it's attacking one particular part of the brain, and this sometimes people may not recognize that it's a seizure, because maybe we were talking like this, God forbid, and then all of a sudden I go mute, like now the way I've gone, then I come back again.
So that one does not involve movement.
But there's already seizure activities happening in the brain. I was to explain before about uncontrolled electrical activities in the brain. Okay. Now that someone going mute and coming back, most people may not know that this person has gone into seizure, but probably he had the seizure, or she had the seizures, but since it is not a common one and people cannot easily pick up, so we always forego that. Or someone goes into laughter, okay? We're talking, then all of a sudden you laugh out of the topic, okay?
That's
Completely. Yes.
When something is not humorous.
Yes. Just you are not even, we are not supposed to laugh, but you have already laughed, and you cannot seem to stop that laughter for a short time, then you come back to normal. And you're asking, why were you very happy and laughing, and no stimulus for happiness has been stimulated, but already someone is super happy, and later on they come back to normal. Okay, so these are focal. Okay, or someone was busy concentrating, like the way you're writing. Okay, then all of a sudden you just stop with your pen. Okay, these are focal seizures. So you can't continue. You're there mute. You can't write more. What has happened? Seizures are happening in the brain. Okay. Now we have the partial one that comes. You find like jerking motions in one hand. Okay. And then after some time it stops, or someone is twitching the mouth, or closing the eyes and blinking and opening at the same time. Okay. This is a partial one. Then from there, normally start with that partial. Then you go into a generalized one now. So the generalized seizure now, this is one which comes with the motions of the muscles now. You're going to have tonic and what you call the clonic motions of the muscles. So complete jerking, okay? Jerking continuously, repeatedly, maybe for more than even 30 seconds. So this one normally now comes with what everyone would see from a distance, okay? Maybe you go, even you fall down if you are sitting, you fall down, you stretch for long, foams in the mouth. Sometimes you can't control your urine. You find someone has passed urine without knowing, and all of a sudden become unconscious. Then when they wake up, they can't tell you what has been going on. So this is generalized seizure now. So this is what everyone can see, and that is what people describe now with convulsion, and is what normally bring most patients to the hospital. Even the nearby people will always see that, okay, someone is really having a convulsion, and they take that person to the hospital. But the focal and partial one is normally not picked by the common people.
That's quite interesting. There are so many involuntary actions and inactions. Personally, I really like breaking into laughter, into a frenzy of laughter. So how do I tell that this is, I could be convulsing unknowingly?
True, but you rule out other causes of someone being happy. You never know, like if you go into laughter, at least there's something that has psyched you, there's something that has made you feel happy, and then, you just, maybe you're in your phone and then you read a message, a nice one, of course you go into laughter, so people may be wondering why is he so happy all of a sudden, but then at the end of the day, what you're talking about, it is quite a different scenario, quite a different scenario.
All right, okay, now, what are the possible triggers or causes of convulsion?
Convulsion is, when we look at it clearly, it has so many causes. And the one common one I would say is the one which we say is unknown or idiopathic. So this one is contributes the largest percentage of the cause of convulsion. And normally it is linked to genetic, like it's inherited. Okay, a common one people say is epilepsy. Okay, so this is something that most people inherit. It's genetical. You have a foci in the brain that abnormally fires the electrical activities and causes the seizures, and later on turn into a massive convulsion. Okay, but then we have other causes that we can talk of: infection. Okay, for instance, children, okay, if you have malaria can cause you convulsion because it crosses the brain barrier and then goes to the brain, so it causes convulsion. Also in children, very high temperature, okay, what is called febrile convulsion, it can also make them have convulsion, but it's normally between 1 to 6 years. So they normally develop this. A child, all of a sudden, temperature goes very high, maybe 39 or 40 degrees Celsius. These children are always at risk of having convulsion. And this convulsion is termed febrile convulsion. They have no infection, but the temperature has just gone very high. And this disturbs the regulatory mechanisms in the brain and make them have convulsion. Other things is what is called systemic, like you have kidney failure, you have liver failure. All these, you tend to have having a lot of toxins in the body because these organs are not working well. And when they cross to the brain, they can also make you have convulsions. Other thing is you have a tumor or you have a cancer in the brain. You also tend to have the convulsion. Other thing is you have, for instance, stroke, or you have too much bleeding in the brain, or you have part of the brain not receiving a lot of blood, a topic that we have discussed before. It can also make you have a form of convulsions. Others, like maybe people are abusing drugs, you can also head into having convulsion sort of behaviors. Then like a common one also is injury, like head injury. People who get involved in an accident, they tend to develop also convulsion because they get injury to the brain cells, and when you do that, they also tend to have convulsions also. Yeah, I think basically that plus those are the few causes of convulsion that we can think of. Though there are others also, and many. Yes.
So
yes,
are incessant convulsions always a sign of underlying illnesses?
I don't think so. It's a form of convulsion that I can go back to what I've discussed about the focal. Okay, what I talk about someone going into a state of laughter for a long period of time, and then you may think they're normal, but then they're undergoing a convulsion. So basically, it falls under focal form of convulsion. Yes.
Right.
Yes, yes.
Oh, okay. Now, is there any, no, maybe before we get to that, is it this process of convulsion, how does it affect the body generally? Is it draining? Can it cause some external injuries or damages to the patient?
Yeah, basically, it is like if you look at convulsion itself, for you to get up or pick up your pen or type something, you need a command from the brain. You need a command from the brain. There's coordination, and this state you coordinate. You make a very good communication. I want to make one step, okay? You make that step and then you come back. Now, in a state of convulsion, that coordination is literally lost, okay? Now, if you are eating, you coordinate how your tongue and where it should go so that you can chew and don't bite your tongue. Now, in a convulsion state, you do not have that control, so you end up even biting your tongue. Very severe convulsion can lead to even a fracture, okay? You can get rapid contraction of the muscles and get contractions. You get fractures of the bone also. And if you get convulsion, in a simple term, maybe now what's happening in the brain in form of seizures, you having electrical wires which are attaching one another. Okay, so you're getting short circuits happening in the brain. Because of this, you also injure some of the brain cells. And if you realize people who have had uncontrolled, repeated convulsion for a very long period of time, the IQ or the rate of, they tend to have a little bit of mental problem, especially in children. If they've ever had several episodes and they have not been controlled well, it tends to affect their brain functioning at some moment, because you are having a short-circuiting in the brain, and this can cause injury to the brain cells itself also. Other things that convulsion can lead to is when you convulse for a long period of time, you lose control, and therefore you can have a form of vomiting, and therefore you cannot control it, and you may end up swallowing instead of vomiting it out, and you don't swallow it, or you rather inhale it, and you take it into your lung, and this leads to what is called aspiration pneumonia now in a medical term. And when you get this, it also becomes a very serious medical condition to manage, because whatever has entered your lung, they're not supposed to be there, and therefore it leads to infection and also sort of complications. Okay. Yes.
Okay, thank you. I know you have mentioned that some of the manifestation or the signs of convulsion, but what are these red flags that are pointers when someone that people should watch out for to be able to tell that this is a convulsion?
Normally, for instance, if the cause is what we say, maybe let's give a simple one like epilepsy. Okay, is what is called the aura. Okay, the aura means the early signs and the early warning signs of a seizure coming. And people who normally have epilepsy, they can tell you. Okay, normally manifest with either feeling like vomiting. Okay, like even they end up vomiting. Okay, they can tell, or a bit of stomach discomfort. These are like the pre-signs of a seizure which is coming. But this is in people who already have ever had seizures before. For instance, people who have epilepsy, so they have known their body and they have learned how this convulsion comes, so they can be able to tell that something is coming up. But also for our mothers, if you see a child, you having a child after before maybe you are giving a child something 3 minutes ago, the temperature was normal, the child was playful, then from nowhere you check this child after 5 minutes and the temperature is, you feel the body as if it's burning you. You should be worried about this. And if you're a mother, if you have any nearby hospital or you have any pain medication for fever, like Panadol, that most mothers always have anyway at home, you need to work very hard to make sure you bring down this temperature. Because if you do not control within 30 minutes and this temperature keeps shooting up, your child is probably going to have convulsion if the child has ever had what is called a febrile convulsion, or even if she has never had, or the child has never had, but you see a temperature going super high, make sure you control this temperature. It will help.
Thank you for that, Dr. Okullo. That's quite in-depth, dear viewer. It's time to take a breather, but there is still quite a lot to know about convulsions, including treatment modalities, preventive measures, and first aid in case you have a patient who develops convulsions at home. So stay put.
Capuchin TV, your Catholic identity. Welcome to Misericordiae Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located between Tom Mboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecology services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospital CBD. We assure you of timely, efficient, and satisfactory services.
Capuchin TV, your Catholic broadcasting ministry.
Welcome back, and we are glad you're still following this discourse. It is Friday Health Discourse, and we are delving deep into convulsions. And as you heard in our first part of this discussions, that there are so many, quite an array of illnesses or medical conditions that could really spark convulsions. And we move on swiftly, but before we get back to our guest, Dr. Okullo Isaac from Mater Hospital, allow me to read some of your feedback. We have Charlene Kapara who says, "Good morning, I can get you clearly." Okay, thank you, Charlene. We have Monique Magdalena. She says, "Good morning, following from Coastal Region." Thank you very much, Monique, Charlene, and the rest who are watching. And for those who have directed their feedback to our number 0717-424-866, I believe the person in charge will move swiftly to make sure that we access those questions and update you or go through them as and when the time allows. Welcome back to the second session, Dr. Okullo.
Thank you.
All right, now, first, before we went for a break, you mentioned the different types, the most common types of convulsion, that is focal, partial, and generalized, right?
Yes.
So now, are these the focal and partial, do they require treatment? And if not attended to early, could they degenerate into the generalized category of convulsion?
I think all of them require treatment, whether it's a focal, whether it's partial, whether it's generalized, they all require treatment. Even the focal one requires treatment. But then now, as I said before, the focal and the partial sometimes is not picked earlier by maybe the family members or even by the patient, him or herself. Okay, the generalized is normally picked because it's massive presentation. So these normally come and they are given treatment instantly. But in other words, all of them needs to be treated because all of them have side effect in the body. Though in a generalized, it has more effect, much effect to the patient than the focal and the partial. But they all require treatment.
But the two, can they degenerate into generalized and become worse?
Yes. From partial, you can go to generalized. Okay. Even from focal, you can go to generalized. Most people normally start with the focal and partial, and then they end up in generalized. But some cases, they start straight away with generalized, and they go direct as it comes at once. Okay.
And,
yes.
And is there any medically recommended first aid for convulsing patients, especially at home?
Yeah, quite difficult. But you see now, if a patient is convulsing, it is generally difficult for you to give the first aid in that state of convulsion. Okay. Now, for instance, a patient who is convulsing is at risk of biting the tongue, okay? And you realize at home we do not have these gadgets that you put in the mouth to protect someone from biting the tongue, okay? But in the hospital, we tend to have that. We put something in their mouth to protect them, in that even if they're convulsing, they don't bite their tongue. They end up having that thing in their mouth, okay? Another good point is everyone who convulses, chances are high that they go into what I've said before, like aspiration. So what you need to do is, in that rapid state, you find it's very difficult for you even to turn this patient or to control this patient unless they come back to a flex, to an easy position. And when they come back an easy position, normally what we advise is you place them in a position called the left lateral position. The left lateral position is a position whereby we place almost all patients who become unconscious because we want to make them stay in a position whereby they do not aspirate anything coming from the stomach into their lungs. So that's the simplest we can do at home. But the best thing is the moment you experience that, you rush the patients to the hospital. Yes.
Arlene Assessor is asking, can convulsion be considered as a brain? Is it a brain disease?
We can say that convulsion is a brain disease because the source of convulsions or where it originates from, it's from the brain. Okay. But then, to say it's a brain disease per se, it's a general thing. Because if you have a problem in your body, it will also affect your brain. Now, when you talk of a brain disease, we're talking of epilepsy. That is straight away the cause okay, because you have a foci in the brain that is triggering this abnormal firing of electrical activities. And this qualifies convulsion to be a brain disease, okay? It's something within the brain. If you have a tumor in the brain, because if you have a tumor in your leg, it won't cause you convulsion. Until when it spreads and goes to the brain, that's when it starts the convulsion. So generally it's a brain disease.
Thank you for that, Eileen. I hope your question is answered. And now to the treatment, because everything, after saying everything, at the end of the day, someone needs to know, is this disease or condition treatable? Is it curable? What are these available treatment options for patients with convulsion?
Okay, convulsions is, I'm making an approach according to the cause, okay? If the cause, for instance, is febrile, like for children, febrile convulsion, they go into convulsion because the temperature is high. Now, when you control your temperature well, this child will never convulse. And in that state, you have controlled and treated the convulsion, okay? If the cause of convulsion is infection, for instance, malaria, cerebral malaria, you treat the malaria, you prevent the malaria, your child will never have convulsion. If the cause of the convulsion is a derangement, or what we're calling metabolic problem, for instance, the liver failure or the kidney failure, you control the kidney problem well, you will not have convulsion. If the cause of the convulsion is electrical activities or electrolyte imbalance, like you're having electrolyte imbalance, like maybe low sodium or low potassium or something like that, you correct your electrolyte well, you will not have the convulsion. If your cause of convulsion is maybe high level of blood sugars or low level of blood sugars, when you control the blood sugars well in people who have diabetes, or people who are not eating well, or people who have maybe a problem with what we call people who are having problem with the pancreas, they're having too much secretion of insulin, and therefore making them go into low blood level. You control the blood sugar well, they will not have the convulsion. Okay. Now the one which is more technical is now the convulsion coming as a result of the tumor in the brain. Okay. You have a tumor in the brain now. Now this tumor, when you remove it, okay, by maybe surgery, the neurosurgeon, or you use radiotherapy or chemotherapy or any sort of that, okay? When you remove this tumor, chances of this patient having convulsion will also go down, and complete reduction or complete removal of tumors leads to complete cure of the convulsion. But if the insult is still there, this particular patient will be having continuous convulsion. Now, which part of the brain is the tumor situated is also very important. Others is in a bad place that you cannot even tamper with, and makes this patient have very difficult ways of controlling the convulsion. Having said that, there are people who are having epilepsy now. These ones are people who inherited this disease. They have a foci problem in the brain. In other situations, they can also be done surgery because there's a particular part in the brain that is affected mostly in epileptic patients. Now, they can also remove that particular part of the brain, and the threshold of epilepsy or seizures or convulsion will also go down. Okay, but there are medications in the market. We call them anticonvulsants that were normally given to control the convulsions. So if you have a patient with a rapid onset, not known, has just started from nowhere, when we say maybe secondary seizures, so these people, always you start them on medication, urgent medication to slow down the convulsion. Then you go ahead and investigate and find out why are they convulsing. If the source is curable, then you treat the cause, and then the convulsion will stop.
So in essence, there is always a reason or an underlying condition that causes convulsion.
Yes.
So once this patient has been brought to hospital and you have performed some tests on them, how do you ensure or manage the frequency of convulsions, and how long can it tentatively take for this patient to stop the incessant
Normally what happens when the patient comes to the hospital, if the patient convulse from home, the medication we give them, we call them a loading dose. We can talk of phenytoin. Okay, then we put them on maintenance medication also, which are anticonvulsant. Now, if they come and they're actively convulsing, we will start them also on fast-acting anticonvulsant that we give them to make sure the convulsion goes down. Now, if the convulsion is not going down on this medication and is actively going on, this patient is at risk of becoming unconscious. Okay, this patient is also at risk of not controlling his or her breathing. So the patients who are convulsing continuously and not stopping or happening repeatedly, even on good medication to stop it, these patients are always sent to ICU. Okay, and when they're sent to ICU, we intubate them and we sedate and paralyze them. Okay, when you talk of sedation and paralysis is, we give you medication to sleep and we give you medication to relax your muscles. In other words, you've been put to sleep by force with the medication in the hospital so that your brain should not be controlling so many activities. We put your brain at rest.
So during this time, how long does it take, and what kind do you administer any treatment to make sure that when they come back from the sleep, they don't convulse?
So now when you do that, you go into finding out why are they convulsing continuously. Now in that state, when they're asleep and paralyzed, you're now doing your workout, your imaging, you're doing a brain MRI, you're doing what you call EEG of the brain. You can do brain MRI, MRA and MRV. And then you do also these lab tests to check all the organs and see is there any organ problem. When you do an MRI of the brain, you're looking at is there any rupture in the brain, is there any tumor in the brain, is there any injury, okay, in the body. Looking at the blood level, you're looking at organs, you're looking at the kidney, you're looking at the liver, you're looking at the blood sugar, you're looking at the electrolytes in the body. So at that time, you now have ample time to investigate these patients very well. But then if they are convulsing actively, even you cannot do anything. The only thing you want to do is stop the convulsion, you see. Because the main treatment and aim is to stop the convulsion as soon as possible and find out the cause and try to correct the cause. Yes.
That's quite clear. Now, these convulsions, are they really preventable given that there are so many precursors of the condition, or let's say manifestation of convulsions?
They're preventable as per se, but as we can put it clearly, it is not like a contagious disease that you can spread from one person to another. This is a disease that will attack one person and maybe stay with that person. And if I do have it, I cannot easily give it to another person. Okay, so that means how do I control it? It is more individual based. Okay, if I have the gene, if a patient has the gene of convulsion, therefore, the best for this patient is to always be put on medication and the patient to be consistent with the medication, okay? But sometimes if they do well and they're okay and they've stayed for long without having medication, they always wean off the medication also. They get off the medication and then they stay. But at times they tend to get a recurrence. So when they get a recurrence, you restart them on medication. But the people are always supposed to be in a long-term treatment for epilepsy, because in case you stop the medication, they tend to have the recurrency. Okay.
So there are no any recommended measures that one can adopt to put the convulsions at bay?
The recommended measures could be what is causing the convulsion. For instance, if you have maybe blood sugars, you need to make sure you control your sugar. The methods you put to control the sugars well, so that they're not on the roof and they're not below, it is the measures that will help us to control and prevent the occurrence of the convulsion. Measures to prevent road traffic accident. Of course, you get involved in road traffic accident, you get a brain injury, definitely you'll go into convulsion probably, and if not handled well, it can cost someone's life. Okay, organ failures. Okay, infections like malaria, for instance, that bring febrile convulsion, that bring cerebral malaria. Okay, if you prevent malaria, you have good measures. You don't reach into a state of having infection crossing to the brain and causing brain problem. When you talk of the cancer of the brain, this I can't say the recommended prevention on ways to prevent someone from getting cancers, but there's so many hypotheses out there. People are saying this one brings cancer, this one doesn't bring cancer. So whatever information we can get about prevention of cancer will also help us not to have brain tumors, because the moment you have brain tumor, definitely convulsion is inevitable. It will always come.
But our time is running out so fast, but before we close this discussion, please tell us, what is the likely prognosis of convulsions on patients?
Prognosis is still taking me back to the type and the cause. If the cause is hereditary, like epilepsy, or you don't expect to get out of it easily. Okay, convulsion will always, or seizure or epilepsy will always be there. So you need to know your condition and learn to live with it and control by having medication and avoiding behaviors that can put you at risk of convulsion. If it is in children, like febrile convulsion, it is treatable, and normally when they reach 6 years, it gets out of, they actually come out of it. They do not convulse again. But some few percentage, like 1 to 2% of these people always end up having epilepsy in the later age. They start as febrile convulsion in children, and then it passes as epilepsy in adults. Okay, so these, when the parent gets to know the transition from now 6 years, this child is still convulsing, then we now get the diagnosis from febrile convulsion to probably epilepsy in a child or in someone now.
All right, finally, let's see, as your parting shot, there is a lot of myths, let me say, that are associated with the convulsions. Some link them to superstitious, witchcraft, especially in remote places in our villages. We are Africans and we cannot deny that. And there's also a lot of stigma and discrimination that is associated with the people who tend to convulse, especially frequent convulsions, frequent convulsions. What would you say about that?
That's something that medically is not proven, because if you look at there are some children who are predisposed to having convulsion even when their relatives didn't have that, because during the maybe conception, during delivery, something did not go right. For instance, if during delivery a child gets an injury, okay, or has stayed for so long without being delivered, what's called prolonged labor, and they get what's called hypoxia or hypoxic syndrome, they tend to have the convulsion symptoms. If children who get what is called cerebral palsy, normally happens also during delivery, they also tend to have this kind of presentation in form of convulsion or in form of seizures. So we cannot criticize our fathers and mothers because they did not have evidence to prove that this is a medical condition. This might have happened during delivery, and this might have happened when the child was conceived. So they do not have the proof for this, but in medical we have this, and we know that there are always a cause for this convulsion. So it's not related to any bad wishes or anything. Okay.
So how do they deal with the discrimination?
So the discrimination is normally there because even when you realize when someone fall down and start convulsing, people tend to move away. But ideally, with the new teaching now and you being informed that when someone convulses, cannot transmit this convulsion to you. This is not a contagious disease. It is actually more friendly than when you have someone having cholera or having monkeypox or having coronavirus. It is worse than someone who is convulsing, because this convulsing patient will not transmit the convulsion to you. But someone who is having corona, who is having chicken pox, or having what, will transmit to you direct. So I think it's good for the public to know that this is not infectious. It's just somebody who is having an infection and is in the brain, is having a problem and needs to be assisted. So no need to run away from these people. It's always to assist them and stand with them and let them get the best medical care.
Thank you very much,
Okay.
Dr. Okullo, for your time and sharing the knowledge about convulsions. We really
so much.
appreciate that.
Welcome.
Great personal gratitudes and regards to the team back there at Mater Hospital.
Okay.
All right, dear
Thank
viewer,
you.
this is how we close today's Discourse Friday Health Discourse, and I'd just like to appreciate you, especially those who took their time to participate in this discussion. I believe you've gleaned enough that would help you whenever you have a patient, a friend, a family member who experiences or develops convulsions at home. You know what to do, you know what precautionary measures to take in order to stay safe. So right now it is a wrap, but as usual, I am never alone. There is quite a team behind the scenes, and I'd like to appreciate their efforts. We had Christopher Diambo manning the cameras, and on sound we had Eric Otieno. Thank you very much, Eric. Visual mixing, we had none other than Michael Ndegwa. Thank you for that prowess in visual mixing. And then at the transmission desk, we had Michael Kibandi. I'd like to appreciate all who have contributed in one way or the other in the preparation, including Sister Mweni Bernadette from Mater Hospital, Father Vincent Shumira. Thank you all who participated or contributed in terms of making sure that this goes on air and in a smooth way. My name is Sasha Elizabeth. I wish you a great weekend. Ensure that you stay healthy and informed wherever you are. So see you next time. Goodbye.
Okay.
Capuchin TV, your Catholic broadcasting ministry. Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
we serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we 5 p.m. in the evening. So feel welcome to Mater Misericordiae Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordiae Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.